Let's talk about IBS in men. There are some key differences between IBS in men and IBS in women, and it's important to acknowledge and address those differences. IBS is often considered to be primarily a female problem, but the data tells a different story. Roughly 10% of the population in the United States is affected by IBS, and of that number, only slightly less than half are men, according to the American College of Gastroenterology. That puts us at well over 15 million men who are suffering from IBS. Now that's a big number. What are the signs and symptoms of IBS in men? IBS is really a very broad term and it involves a number of digestive problems. Men with IBS report having diarrhea, constipation, abdominal pain, gas, or bloating. Although men and women can have the same symptoms, in general, men tend to experience more diarrhea than women. Men also sometimes experience related issues such as IBS and prostate issues. And it's not unusual for men who experience IBS to also have heartburn or reflux. What is often surprising to people is the lack of valuable information that they receive relevant to their IBS after undergoing a colonoscopy when they visit the gastroenterologist. Colonoscopies rule out and treat other things, but they rarely, if ever, shed light on the symptoms or the causes of IBS. People with IBS report a wide variety of health problems and different types of bowel movements. For example, constipation can range from multiple daily bowel movements that never seem to be completely evacuated to one bowel movement that only happens every several days or even sometimes a week or two. Bouts of diarrhea also can be many times a day, or they can be every few days between bouts of constipation, or they can be immediately after constipation. And episodes can come days or even weeks between normal days of bowel movements. So you can see there's a broad range in this world of IBS. Now, some people with irritable bowel syndrome have abdominal pain, and some don't. And same goes for IBS with diarrhea or constipation or even gas and bloating. Some people have all of those, some people just have one or two of those symptoms. The gastrointestinal disorders suffered in IBS vary from person to person, but they always have at least one of those symptoms. Now, what causes IBS in men? Now, as many men have experienced, it's not unusual to go to the doctor and discover that nothing is really wrong, right? Or that all of the tests are normal. Now, of the tests that might come back abnormal, the SIBO breath test is the most popular test for IBS and is used sometimes in an attempt to diagnose small intestinal bacterial overgrowth. It stands for SIBO. Unfortunately, this test is difficult to perform properly, which often leads to a misdiagnosis. It's also difficult to treat, and many people who test positive do not respond to treatment or only respond temporarily to the treatment. There are a multitude of causes for this and why this often goes undiagnosed, and none of the causes of IBS are visible on a colonoscopy. Now, bacterial overgrowths don't show up on a colonoscopy, and if they don't show up on breath tests, they can go undiagnosed. Same goes for candida overgrowths that are often undiagnosed or misdiagnosed or missed altogether. Same thing for microscopic parasites that doctors fail to test for, or food sensitivities and intolerances that most doctors fail to appreciate, and those things can hide for years or even decades and fake you out because your symptoms never seem to correlate with anything that you eat. Does that sound familiar? Those are just a few of the causes of IBS in men. There's also enzyme production, hydrochloric acid production, probiotic levels, and many other things that can cause IBS. There's no lack of causes. The challenge is in finding a doctor who can help you find the right cause for you. So now, what about IBS treatment for men? Well, quality IBS treatment in men is the kind of treatment that results in long-term resolution of your symptoms. And that's going to vary depending on the cause of your IBS. Now, there are a few medications out there, right, for IBS and some stock treatments for IBS, but they rarely work well or for very long, and they're really not worth mentioning and getting into here. The same goes for generic IBS diets, and you probably heard of some like the low FODMAP diet. Highly effective treatment requires IBS detective work, not just the kind of detective work that the gastroenterologist does, because that's only ruling out other things, but the kind of IBS detective work you need to determine exactly what the cause is for your symptoms. Only then can an effective treatment plan be developed for your IBS. The good news is that IBS is very treatable, and you should expect excellent results. If you aren't getting them, then you haven't seen the right kind of doctor yet. Now, what about IBS and chronic prostatitis? Now, this is a little discussed overlap between IBS in men and this issue of chronic prostatitis, but it does happen, and the prostate is in fact in direct contact with the colon, and inflammation in either area can impact the other organ. And men who suffer from chronic prostatitis also notice they often have digestive problems. So chronic prostatitis is particularly challenging to treat, especially when it is overlapping with IBS. So it's important to get both treated to get the best outcome. There's also something we're talking about, IBS and prostate cancer. So like IBS and prostatitis, IBS and prostate cancer can also be related. IBS in men who have prostate cancer find that the IBS often occurs after treatment for their cancer. And the treatment may involve radiation or chemotherapy, and that treatment can impact the digestive system, which in turn can cause IBS symptoms. There's also the issue of IBS and urinary problems. So can IBS cause urinary problems? Well, absolutely. Both of the issues that we just discussed with the prostate will cause problems with urination. However, there are more common causes that do not involve the prostate. More common is the fact that the intestinal tract and the bladder are in immediate contact down there in your abdomen. And if you have constipation, for example, or you have large bloating, that's really bothersome, then the expansion and the pressure of those is felt directly on the bladder, which make you feel like you have the need to urinate, right? In the case of diarrhea, the spasms that might occur with that, or the inflammation that can be related to your diarrhea, can also impact your bladder because they're right there, they're right next to each other, and that can also cause you to have frequent urination. Another topic is IBS and sex, and this is an important topic because IBS in men is a major factor impacting intimate relationships and can significantly reduce desire for physical contact and confidence in the bedroom. This has largely gone unstudied, unfortunately, but IBS has undoubtedly had a significant impact on an untold number of relationships, sexual or otherwise, for both its physical and mental impacts on men. Now, IBS has a major impact on quality of life, changing the way people go about their daily lives and impacting the decisions that they make about what they can do in the day or where they can go. And you may have experienced this. Over time, this adds up to a significant amount of missed opportunities and experiences. And this is no laughing matter about IBS. It should not be taken lightly. And you are encouraged to seek medical attention from an IBS expert, not just a gastroenterologist. How is IBS affecting your life?